Hello, Monarch family patients. We are excited to have you with us. Today's topic for our workshop is healthy curves. So we want to talk about the curves of our spine. As you hear a lot in this office, it is about having healthy curves for the longevity of your life, right? The longevity of your spine. And so I want to talk you through the background I've had as a chiropractor, and the several years before I became a chiropractor, working for chiropractors, was all based on posture and was all based on helping and correcting curves so that we had a more stable, healthy, mobile, functioning spine for the rest of our lives. So not in the sense of just managing symptoms and pain. Chiropractic is very good at doing such things and getting relief of pain symptoms, but we're really looking at the longevity of how healthy your spine can be to keep you going through life. One of my chiropractors early in practice or early in my life that took care of me always just said, you can replace lots of parts and pieces. You can replace lots of things that you have that are material things. We get one spine in our life, and they've started to have surgeries and do things to try to give you other parts and pieces to replace ones that break down, but you're never going to have that original part and piece again, right? So it's never going to work quite the same. So the best that we can do is taking care of our curves, because that's what supports the weight of our frame. So we're going to back up a second. And now that you know what we're going to talk about in today's topic, in this workshop, kind of get to introduce myself to all of you, because Dr. Mayakin's been doing most of the workshops, and this is something I'm very passionate about because of my background and how I got into chiropractic. The destruction of my mom's spinal curve in her 40s had been from probably 1 to 2 multiple car accidents that she had been in, and also a lot of postural things throughout her career that drastically changed her ability to function, and didn't know it was happening. And so it was a piece that changed the trajectory of her life, understanding how important her curve was to her function. And so I want to talk a little bit about that and show you a couple slides, because I know you hear about it in here, but we want you to understand the what and the why, and why it's so important in the big picture to your nervous system and your brain being healthy and functioning. So the longevity of that, as well as the biomechanical structure of the bones, need to stay in a good shape so that they stay healthy and don't degenerate. So when we have a spine that's healthy, should have curves, right? So we think about from the front view, use our spine model like we do when you're in the office, right? It should be straight, front to back. From the side view, right? Looking at us from the side, we should have curves. So we should have a low back curve that looks like a C or a backward C, depending on how you're looking at this. We should have a mid back curve that does the opposite. And we should have a neck curve that does that. All of these curves, like that S shape, support the weight of our frame and support the spinal cord that the bones, that the spinal vertebra are protecting and housing. So the best movement these can have, the healthier the nervous system and the spinal cord can be, that is being protected on the inside. So and again, we all know that the connection of the spinal nerves here coming off of each vertebra are connected at the center at your spinal cord, and are ultimately just the extension of your brain. So as your brain sits up here with your skull right here, it is really important that everything that's encased in bone stay protected and moving properly, right? And functioning properly. So if those curves aren't intact, brain doesn't get a clear signal out to the body of what to do at all your parts and pieces, and it certainly doesn't get a signal back up from body to brain at 100% function and capacity either. So as we get into talking about curves, let's look at a few studies. If I can get my screen to work. There we go. So looking at a healthy spine or healthy vertebra versus an unhealthy one, this is a model picture of going from left to right, healthy movement and discs, which is the space between the bones. And then as we have proper movement, or we get loss of good movement and function, then we start to see decay, or what people hear as degeneration, or what most people talk about as arthritis. That is the bones and the movement of the spine not happening properly over years and forming that arthritic degeneration. That can all be diminished and really limited in happening in our spine if we take care of it right and we have the curve. So we want to just kind of give you a quick anatomy of what's between each bone is the disc. That's a gel kind of cushion that protects the bones from touching and keeps that space so that those little nerves that are exiting there at each of those openings on the left and on the right have room to breathe, to move, and to send that signal from brain to body to work that part of you and allow that function to happen. So when there's that improper motion, we get improper signal, and then over time becomes usually pain is what we recognize as pain. So there's a few things that we talk about in curves that are so important, which is that you have them and that they're not leaning left or right, and that they're not leaning forward, or that we're not leaning back, so that when we check our posture like we do in here, our ears over our shoulders, shoulders over our hips. Or do we have a forward posture? Or do we have a backwards tilt and lean? So all those things play into the functionality and healthy properties of the spine. One thing that neurologists across the board have termed a healthy curve or having a curve is that it is really, we talk about posture as the window to your spine. They say that your curve is just vital to life, and that it should be called the arc of life. For that reason, they know that if those arcs aren't there, literal life signal from your brain to your body is diminished. So when we lose curves, a big thing that happens is those discs, the cushion space between them that protect everything from touching things they're not supposed to touch, is diminished, and therefore they dry up. When a posture gets pulled into this forward motion, or even straight, which we see a lot in this office, and with our patients, young and older, it takes the space where the disc is and it compresses it. And so it pushes that disc out of its place and into areas it shouldn't go, and it dehydrates it. And it doesn't, again, allow it to move proper. So it gets kind of that decrepit feeling of poor movement, and then the poor function, which in a sense then just makes it in what we would kind of say feels arthritic over time. Things that we do know from the change of bones, and what, again, you would recognize that as is when we tend to hear arthritis. And I like to cover the fact that when those things happen, the spine ages rapidly. So we will tend to see that, and through lots of research, and we'll get into a little bit of it in a minute, that when you have a loss of curve, and you're going from the phases that are on the screen now, from phase 1 to 2, we know that has possibly been there anywhere from like 7 to 15 years. So an average of 10 years when we start seeing those phase changes. So it's not something that happens overnight. It's not something that happens in a couple months or even a year's time. But when trauma happens and things don't get repaired or restored, then that starts taking a toll and aging literally the spine and the body's ability to function and then heal. So when people say a lot of times to us, oh, I'm getting older. It's just age. I'm going to get arthritis. Well, that is not true in the science world. A lot of research shows how a spine is able to withstand a lot of force for a long time if it functions and moves properly and has support. Meaning they show that about to 100 to 120 years is what they say the life of our spine should be able to go, and not, look at a degenerated age if well taken care of in our 50s, 60s, 70s. So we know that we can slow down the process by supporting it and giving it the stability that it needs. Some of the things and the most often things that we see in the office as to when people want to know, well, why does it happen? It's really common for just our day-to-day activities, unfortunately, in this day and age. Technology is lovely, and lovely when it works and serves us to be mobile and to be more advanced. And yet it's because of that, a lot of portability, it allows us to be in very poor postures when we use it. So perfect examples is, what do most people look like when they're on their cell phone? It is certainly not the majority to have someone have their phone and hold it here and be on it, right? We see a lot of this where people sit down, it's down in their laps, it's down in their, at their, I'd say elbow level, and not being held up at eye level. It's the same thing with reading, spending a lot of time, in a book would do the same thing. Lots of years of school, lots of poor posture in not sitting up straight and looking forward. And people then in later life having computer or desk or very sedentary jobs, sitting at a computer that isn't built or designed to keep your posture in a good alignment, starts to slowly degenerate it day to day. So it's a lot of repetitive traumas, if you will, that way, not necessarily having to come from a car accident or a whiplash type trauma. And I'll say, living in Colorado, we see lots of different things because we have such an active state and things you can do year round, meaning we will see it from a skiing, fall, or a concussion of a kid playing sports, or concussing, yourself on the slopes when you take a really hard landing. So it can come in multiple forms, but it can be, very traumatic, where you can do some damage to ligaments and injure things with a single injury, like an accident or trauma like that with whiplash, or it's more often just the repetitive movement of what we do day to day, inside and out through our daily motions and activities of posture. So again, being on phones, looking at a computer screen that isn't set up for us or that's too low, and those types of easy to do repetitive movements in our day to day that we don't tend to think about. And we may have a few. So you see us test your posture here frequently in the office, always at the beginning of care, so that we have a baseline, and then throughout your care, because this happened again over months to years, for most people a decade or longer. And so the process to heal, there's a couple components that we want to talk about there, which is just that it takes time. And healing takes time, and it took a lot of time to get this way. And so even though we may not have felt it as long as it has been that way, we have to give ourselves grace and our bodies time to undo some of this process by a lot of postural exercises and what we call interruptions to our day, to reset the system in a way that the brain and body can reconnect of, oh, this is my correct posture. Oh, this is where I want to support myself. These are the muscles I should be engaging in that process. So really, that you don't have to have, and many people don't have a symptom for many, many years as posture or curves are changing and, in a sense, aging. And that I really feel and have seen now with my 15 plus years in the profession and in other offices, watching this transpire with patients that weren't mine yet, is that age isn't a number. And that we see it from some of our younger generation in their 30s, 40s, who had a lot of traumas early on, whether it was sports or other incident related that never got corrected then. I have a lot of 70-plus-year-old patients that their spines look amazing. We will go through a few x-rays. They are not my patient's x-rays in this presentation, but we do have some of those that are always great to be talking about, to see that there are actual patients in their 70s that have very healthy looking spines that look much younger than many. So we're looking at how well your ankles are even to each other, your hips left to right, your torso, the top of your shoulders, and as it centers to your like Adam's apple, or where your clavicle, your sternum meet, and then your eyes. So how balanced is head to shoulders, shoulders to torso and waist to knees, knees to ankles. So those are the components that we're looking at in posture. And we see them then in x-ray translate. The longer they're there, the more the shifts start to happen in your structure that you see there on the left, in an x-ray, where we can tell how long something's been there if it's not functioning proper. From the side view, here are that S curve. That's what we want to see. And so we're going to start talking about those two curves specific. The neck and the low back take the most force, and the curves should be the same. They should be, in looking at this view, a backward shaped C in both the neck and the low back to support your core at your pelvis and support the weight of your 10 to 12 pound head over on top of your shoulders. And so gravity, of course, plays a huge part in this too. So as in this picture, we're looking at what we're paying attention to are the dots lining up to the green plumb line that is straight vertical top to bottom, or are they shifting forward or back of that line? And for every, 10 to 15 degrees of tilt, you gain about another 10 pounds of pressure and weight onto your structure, onto that spine. And again, because of gravity, things start many times up in the upper neck and upper shoulders and back because of our day-to-day postures, and then translate into the lower curves and compress things then as the weight of the head becomes not 12 pounds, but say 24 pounds or 30 pounds, that's that much weight then further into the structure that we don't want to see, that wears and tears on it much faster than it should. So this is just the image being flipped the other way, right? So the chin and mouth, if you will, are on the left, and the back of the skull is there on the right. And that is that C-shaped curve on the left that we want to see. 43-degree curve is optimal for you to see those dark spaces, the dark gray between each vertebra, how each vertebra is very boxy and each bone is very square. And there's that nice dark room in between, and that there's a big space between the back of the skull and that very first bone that you see below it that we call the atlas. The most signal from your brainstem to your body is coming out right there. And so if there is any compression there, and when you lose a curve, there is, I'll show you that in a minute, then it's like we use the example of a garden hose or a light switch, right? And imagine that the brain is the power, and it is like when you have the hose hooked up to your house, right, to your water, and you turn the hose on, the water is at full force shooting out the hose, or should be, and depending on where the kink is, the water doesn't get out to its destination when that pressure is there. And so as much as why neurologists call this the arc of life is because they fully understand that compression without a curve, because of a lack of curve and onto the spinal cord and your nervous system, doesn't allow the brain to signal to your body and give you that vital life force of information that it needs to. It'll diminish it slowly, and then over time you start to feel symptoms or have diagnoses or conditions that you don't know what they're from, because the body has had time to weaken and not be as stable and strong as it should be, and communicating as strong as it should be. So when you have that proper curve, like that picture is right there, then you don't have pressure from where the skull would hit or touch even remotely close to that back of that bone right there, which is the top one you see in the picture. That clear signal is huge to the rest of the body, getting that signal from the brain through your nervous system out to every organ, cell, tissue, muscle, gland in your body to tell it what to do, what it needs. And again, get that signal back up from that part of the body to the brain to tell it just did what you asked. So super purposeful in function. There are tons of research out there that supports correcting curves and supporting a healthy curve. What the picture you see on the right before we flip to those is what it looks like and what a very typical spine in our office can look like to somebody of not any age that I would consider remotely close to older or expecting to see aged on it. So this is again a picture of the neck where there has been trauma or injury at some point. I have multiple x-rays of patients that I have on file at the office that came in with excruciating low back pain. And when taking pictures of their full spine to assess the whole system and the whole body instead of just the low back, realized that much of their pain and their lack of function is coming from areas higher up to the brain that weren't getting the signal clearly, that had been traumatized at some point and had damage that looks like this. So when we can support the function and the movement higher up, many, many, many times, there isn't really there may not even be a structural problem at the lower part of the spine, say in the low back or in the hip. It's coming from all this compression higher up that is putting the back into much more stress than it should be. So in a position like this, I think now looking at the two side to side, it's easy to see that 1, 2, 3, 4th and 5th vertebra are not sitting in a line with each other. The bones, as they change shape like that, lose that space between, right? So that disc, that dark gray in between, is no longer big and fluffy and spacious, and it's not equal from one to the next. It's very thin. And again, that dehydrates the disc and doesn't allow it to be protective. And so the bones start rubbing and touching and improperly moving. And so then their function's different and it starts to age the bone. And then that's where you see those very pointy spots in the front of the bone and along even the bottom of it, where it starts to ridge and kind of lip and not just sit flat. Or you see those very pointy pieces at the front of the vertebra. And that is degeneration that's been there for decades. It takes the body multiple years to lay down extra bone like that. And how I describe why that looks like that and what's happened over time and why that's taken a fair amount of time is, imagine that your spine's supposed to have the curve. And if my wrist was this curve here and I was palming a ball in my hand, and that's the weight of my head, my 12-pound head. And then down here is my shoulders that have to carry that weight. If I have that weight centered over my shoulders, I can hang on to that ball for a fair amount of time without a lot of stress to anything in the system. When I lose that curve, and imagine I still have this 10, 12-pound ball sitting in my palm. If I lose that curve of my neck, or lose that curve of my wrist, then I am trying to palm that weight out here. Gravity takes over and pulls it forward. And all of those muscles back here of my arm are hanging on for dear life, trying to keep that from continuing to fall forward. That is what's happening in your structure over time. And the bones are laying down more calcium, more bone, in order to stop that process from happening. They're trying to slow it down. And you'll see pictures where bones get fused if the degeneration gets past phase 2 into phase 3 or 4, which is not correctable and is very hard to manage even at that point, where the structure has said, I'm going to take over, you're not supporting me, so I'm going to lay down more bone on the front and back of these vertebrae and try to fuse myself to another bone so it can't keep falling forward. And unfortunately, I see a fair amount of that too, that happens, that people just don't know are taking place. So that's why we analyze and evaluate the way we do with our patients, because we want you to know if this is happening, because you can slow down and stop this process if you want to put in the time and the work and the effort. So there's the posture we're used to seeing. That's exactly what it can look like on X-ray. When it happens, those bony spurs that are happening in that picture to your right is because that posture has been forward for probably over 10 years, possibly 20 with the way that looks and the history of patients I've seen. That is the mid-back curve, which is the opposite direction and tends to stay a little healthier longer. But it can straighten. As you can see, the picture from the left is healthy. The picture on the right is it losing that curve as it compresses. Bones do change there. And then this is the low back. So I didn't focus as much on this, but we see lots of low back. I always go to the neck and look and see what that curve is like, because if we don't address that, this doesn't change most times for me. We may be able to manage some pain, but it doesn't support the structure. There's a lot of research out there in curve correction, studied with one of the most famous doctors is Norman Shealy. He's a PhD in a neurosurgeon, and he's, I think, I'd say written or published over 20 books. And he did a lot of work with some of the posture companies that are doing this research, showing that you can increase disc space, you can decompress the spine, and you can help support and get a curve back so that the body then and the nervous system functions like it's supposed to. So those pictures are all showing where there's healthy spines, where those MRIs are being taken pre and post and during these postural exercises and home things we have you do in our office that help show that there's the stability of adding this in creates a change to the disc space, creates that cushion and gel space back, and takes pressure off the spinal cord and the nerves. So again, longevity of your body. other stats to just where you see when you're doing that motion of expanding in an ellipsoidal way versus just somebody who's doing straight traction, like just trying to open a space, but creating that curve with the angle the curve the spine's supposed to go. You see a bigger set of improved angles and disc space and changes to curve than you do if you just try to decompress something. And the best thing I could relate that to is when patients ask me about using a inversion table. And that's another conversation if you want to have it, ask me in the office. But this is why that there's no support to that. There's not a lot of result from that. And there's a lot more opportunity to injure yourself from that because there's not a control factor there. You're just really using your body against gravity, which isn't changing or supporting a curve. So there's lots of research to that as well, but those are literal stats of when they did linear straight traction to where they actually did this type of traction we use in our office. So when you do or don't know your x-rays and where your curves are and aren't, this is where we're here to support that part of your healing process, because ultimately, I say many times in the office, there's keys to, this is all about your healing. And this is all about, that's what we're here for, big picture, right? So yes, we want to get people out of pain and we're really good at doing so and helping the body achieve that. And the bigger picture is that you're functioning in a vital way for not just this week and next year, but the longevity of your life, whether that's 70, 80 years for somebody or it's 100, 120. So a couple key things to that healing is that pressure off the life force, right? Ultimately, signal from brain to body has to be there. When you have a curve, it's there in a better capacity for longer. It's more stable. Second is that it's pressure that's happened over time. So the answer to that in our office is that letting people know healing takes time and it didn't get that way overnight. And it's going to take us some time to slow down and undo and reverse the process of possible aging that's happened in their lifetime. And the third is that consistency is key. This is not something just like with chiropractic that we do for a few visits and we get this kind of result. This is something of multiple visits over time because this took lots of time to get that way. And it takes that repetition, right? The brain learns that cell and muscle and nerve memory when it does it in repetition. So when we do our visits in succession, it's for that reason. We have to retrain patterns in your brain to communicate with your body properly and in a new way, right? We have to teach it a new normal. So many times when these curves are lost, it thinks where you're at is normal, which is like in that posture picture, right? Where someone is leaning sideways, they don't feel like they're tipping forward. They usually don't feel like they're tipping there to the left of our view from center. They feel like they're standing pretty straight. So these things happen as the brain and the neurology changes to where you think you are in space. So I always want people to give themselves grace and understand that we know we want results fast. And what gets us the longevity for our bodies to function is allowing for consistency and giving yourself understanding that this took time and it's going to take time to reverse it. And we get to show lots of pre and post pictures in the office of that happening. So as you get those for yourself, as you're a patient, if you're someone new watching this and looking forward to making these changes after seeing your first picture, know that we're ready to share in that excitement with you as you get on your journey. And if you have other questions for us about curves and what we do to support that, that's where being in the office will walk you through the options we use and what works and fits best for you and your frame and where you're at, and start giving you those tools to help support this corrective process if that's a choice you make for you and your health. So thank you for your time. Thank you for indulging me and letting me talk about one of my favorite topics in helping people with their health. And if you have other questions, please feel free to let us know when you're in the office. And if we haven't met you yet, we look forward to connecting with you. So until next Tuesday, have a very safe and snowy, safe night as we close out, as we start the winter storm and close out. And we will connect with you next Tuesday at 5:45 to 6:15. Bye for now.